About 1 in 8 men will be diagnosed with prostate cancer during their lifetimes. Even more concerning, of those men, 1 in 41 will die from that disease. September is National Prostate Cancer Awareness Month, and here to talk about the warning signs, the screening, and the treatment, our friend Dr. Scott Ackerman. Good morning to you.
Good morning, Vic. Good to see you, sir.
Yeah, absolutely. Thank you for coming on, Doc. And we know that this is typically seen more in older men, but I just recently heard from a friend who is in his 30s who got diagnosed with prostate cancer.
Yes, that's very unusual. Prostate cancer diagnosis increases with age. That's one of the risk factors is age. But we're seeing it more and more in younger men. We're seeing it in men in their 40s. And yes, as you mentioned, there are some men in their 30s even that are diagnosed with prostate cancer. Typically, these people that are diagnosed at a younger age have a stronger family history of prostate cancer, or may have some other risk factors associated with prostate cancer.
So we've heard you talk about this with cancer time and time again. It is about screening and early detection.
Yes. So screening for prostate cancer and it leads to early detection. And when we diagnose prostate cancer early, we have options, lots of options for treatment. So first, let's talk about the screening for prostate cancer. So screening for prostate cancer begins normally for men at the age of 50. And we recommend a PSA test annually and a digital rectal examination annually. If a man has a risk factor, such as a relative with prostate cancer, then we recommend the first screening at the age of 45. If he has two risk factors, which would mean like a relative and maybe he's of African-American descent or a Caribbean Islander, they would be at higher risk as well. We recommend that screening begins at the age of 40. And the screening, as I said, is every year, a digital rectal examination and the PSA. And the PSA is a blood test called the prostate-specific antigen test. And if that's elevated, it doesn't mean you have prostate cancer, but it means that you're at increased risk for having prostate cancer. And that might lead to some other diagnostic tests, including some imaging or maybe even a biopsy.
You know, unfortunately, we have heard from so many people that say, I don't want to get screened. I don't need to. I feel fine. I look fine. I'm healthy. Or I'm nervous about it. I'm embarrassed. I mean, it's not necessarily the friendliest of processes.
No, it's not the most comfortable process. But when you diagnose prostate cancer early, you have options, as I said before. The options are, if it's really caught early, one option is to do what we call active surveillance, which means there's no treatment. We just keep an eye on things. We watch you year to year. Doesn't mean you're getting repeat rectal examination necessarily, but you're checking your PSA, doing some imaging from year to year. We know you have prostate cancer and we're watching it. Or we could treat it with surgery to remove the prostate, or radiation, including proton radiation, which is very targeted on the prostate, a very safe and easy way to treat prostate cancer, which yields an extremely high cure rate. On the other side, if you ignore it and say, oh, I'm healthy, I'm not gonna worry about it, and then you're diagnosed in a later stage when it's already spread beyond the prostate, and God forbid if it's in the bones or somewhere else, then our options are much more limited, and the survival is also much more curtailed.
So it's all about that early diagnosis, the early treatment. Thank you for your time this morning, Dr. Scott Ackerman.
Thank you, Vic.
Again, appreciate what you do at the Ackerman Cancer Center. Give everyone on your team our best.